Next up, House File 645, Representative Lee, disposition of money recovered from litigation or settlement of environmental permit violations.
Thank you, Mr. Chair. I move House File 645 before the committee with recommended referral to the Committee of Health and Finance and Policy.
Representative Lee, to your bill.
Thank you, Mr. Chair and committee members. Currently now, money recovered by the Pollution Control Agency in litigation or in settlement of a permit violation that could have resulted in litigation is state money and must be deposited in the general fund. My bill creates an exception when the pollution control recovers $250,000 or more in litigation or in enforcement settlement from a permit violation and requires that 40% of the money recovered be distributed to the local community health board where the facility is located. The MPCA must notify the applicable community health board within 30 days of a final court order in the litigation or the effective date of the settlement agreement and collect the money and transfer it to the applicable community health board. The health board must meet with the local community impacted by the permit violation and incorporate their concerns into a project that addresses the residents' health concerns resulting from their exposure to pollution. The community health board may recover administrative costs related to the provisions of this paragraph, and this proposal direct the transfer and use of money only and does not create a right of intervention in the litigation or settlement of the enforcement action for any person or entity. And, Mr. Chair, just background information for the members that not have been here the last few years that I have brought the proposal forward. In 2017, the state of Minnesota entered into the settlement agreement with Morning Metals Recycling in my district. And, one of my testifiers, one of my neighbors is here that will, can speak a little bit more about this, was when we found out that of the settlement, not many of that is coming back to the city of Minneapolis to address some of the health concerns of my residents. And I think that, for communities that's been impacted by pollution, that they should receive some kind of restitution from the harm that has been created. And so this is a proposal to make sure that, when there's a settlement or enforcement action above, the figure that I have in here, that the community that's been impacted have a say as to how the money is being used. And with that, Mr. Chair, I'll turn it over to my testifiers.
Roxanne O'Brien, North Minneapolis Environmental Justice. Welcome.
Thank you. Good afternoon. My name is Roxanne O'Brien. Thank you for having me, Fooly. One of the things I really appreciate about Fool is I've never known a public servant as supportive and actually listens to community as much as I have experienced with you, Fool. So I appreciate that. It makes my job a little bit easier, although I've been running around crazy. I'm from North Minneapolis, and if you know my community, we've been through quite a lot over the past few years. Uprisings, police brutality, gun violence, health inequities everywhere, and inequities in every system that impacts us, housing, all that. It's a cumulative impact, right? Like the accumulation of problems happening in our communities. And so, as you can see, there's not many Black people here. Because it's really difficult to have access to people with power who make a lot of decisions that impact us. But here I am today. I just got off the phone with the governor's office and then came right in here to do some testifying. So again, I appreciate you taking the time to hear me out. I do want to say we do have, if you want to be more educated on what's going on in our community, TPT did like a little short documentary on us called Racism is in the Air That We Breathe. Although Black people aren't the only people impacted by this, there are poor white people just on the other side of the river, Northeast residents, a lot of who are, my partners and folks who continue to help push environmental justice. But we have partners everywhere through every part of the government, and I'm hoping today to also recommit that relationship with you all, because we've been here for the past 4 years testifying for a lot of these bills. So real quick, just to get to the point, I was one of the members who have been heavily involved with the situation surrounding Northern Metals, as well as other pollution facilities in our communities, such as GAF, HERC, the list goes on. I think we have about 13 big facilities in our communities that are concentrated in So a lot of our work, we have to go to every part of the government because everybody kind of seems to pass the bill on who's responsible for what around here. So currently, we're working with the city on their zoning changes that are happening now, which is a big way that we can actually change the way our environmental justice communities are treated. So zoning was one of the main ways in which these, yes, zoning is one of the major ways that we've been impacted by this. So there's numerous ways to do this work, but here, Fuli has brought to you 2 bills that could support our work as well, which is, one, if a community is being impacted the most, there shouldn't be money that's going back to an environmental bill that wouldn't impact the community that was harmed in the first place. So I'm here to speak to that. I think one of the main reasons why we got that was because of advocates like myself and other people who, at any point that we could access people with power, once again, at the MPCA, we let them know that it didn't make any sense. Although we're not treated like the experts, we are the experts. And it's interesting that places like Northern Metals, it took about 10 years of volunteer work to shut them down. And we don't really get too much credit for that. But again, I'm here telling you, we are the experts, and we're telling you places like Northern Metals, places like GAF, I'm quite sure there's corruption going on. These permits need to be reviewed. We have politicians who are keeping these facilities in our communities for economic reasons that don't reach the communities, that the people who actually live in the community. So we're asking you to just have a little bit more integrity with how these processes are done in our communities, and this is one way to do that. So if we're being harmed, you know, repair that harm. That's all we're asking for. Just as if your communities were harmed, we would hope the same for you all. And I think, are we still talking about the permit review, or is that the next one? Okay.
The next one.
So I'll leave it at that. Thank you.
Patrick Hanlon, City of Minneapolis. Welcome. State your name for the record.
Chair Hansen, representatives. You may know me from Bill HF673. I was just up here. We'd just like to support, so this is HF672 and HF645 at the same time? Okay, just confirm.
Just 605.
Just for 645, okay,
Just
okay, thanks. So Roxanne is definitely an expert in her community and has definitely driven a lot of change. We've had some good conversations, hard conversations around what's going on in North Minneapolis and other North Minneapolis and South Minneapolis, our environmental justice neighborhoods in Minneapolis. We, in talking about the Northern Metals, that name has been brought up a few times, and there are, I mentioned, plenty of businesses that we work hand in hand with to solve solutions. That was not one where we were able to work together on solutions, and sometimes it comes down to the litigation at the end of the day. And we were out of that settlement agreement. We were able to get some really valuable money, and at the direction of our folks in the environmental justice community, Roxanne being a key member in those conversations, and still is, about how do we get that money out into the community. And so we've been able to test the blood of thousands of children. We've been able to get into homes and do lead remediation work, to do asthma remediation work at the direction of folks in our community. It's been really a great experience. Roxanne talked about a lot of the negative things that are going on in North Minneapolis, but this is an example of some really great work that can be done when we're all working together to resolve issues. And the term that we like to use is children are not lead detectors. And the way that the system currently works is that we end up finding lead in a house by finding it in a kid's blood first. And that's wrong, just to put it simply. And so this sort of funding that gets into local government, where we can go out and do preventative work and test blood, get into homes, and get at the hazards before children can get access to them, is incredibly important. And this is a tool that allows us to do that. And so it allows us to take money from a litigation case and put it back into solutions in the community. And so Minneapolis is in full support of HF645. And thank you for taking my testimony today again. Thank you.
Is there anyone else in the audience who wants to testify on 645? Seeing none, we have several testifiers. First is Representative Jordan, and then we've got Representative Finke, Representative Fisher, and then Representative Heinzman. And we do need to be done at 4:30. Representative Jordan.
Thank you, Mr. Chair. Thank you, Representative Lee, for bringing this forward. I do represent Northeast Minneapolis. I have asthma. I deal with it every day. I have an inhaler in my bag. I think members of this committee have seen me use my inhaler before I present bills in this committee, like I do in every committee, to be able to catch my breath. There are days where I cannot leave my home because the air pollution is so bad that I can't walk more than 3 blocks. And this is Minneapolis. The blocks are not big. The blocks are not big in Northeast Minneapolis. And I'm not a rare resident of Northeast. Many of my neighbors also struggle with asthma. Asthma is the #1 reason prior to COVID why students in the Minneapolis Public School District missed school. This air pollution is something that is impacting people for the rest of their lives. It is making it so children cannot learn in school. It is giving lead poisoning, and if any of you are members of the health committee, we have a number of lead-related bills up tomorrow, so I'm excited to talk to you about lead level limits and lead service lines and everything else that we can do about this. But Representative Lee, I really want to thank you for putting this money into community because we experience it. It's our lungs that are falling apart. It's our lungs that can't breathe the air that we're trying to walk to work or school through. So I'm very curious, and I know that Mr. Hanlon from the City of Minneapolis talked a little bit about this, but I am wondering if you can talk about some of what these grants directly would go towards, and how that would work to make sure that money is going back into community. For example, my inhaler costs $100 with insurance. I'm really happy to have that insurance, but that's an expensive thing. That's an expensive cost for me for one piece of medication that I need to be able to breathe. And so I'm wondering if you can talk to me a little bit more about what these grants would look like and how these grants would be putting money into community. And I see that we're using local government as a pass-through, but I'm wondering how this money is going to go directly to community. And before you do that, I do also really want to thank Ms. O'Brien. You've done a lot of work for a lot of years, and you've not gotten the roses that you deserve. And I'm hoping that things like this will make the work that you're doing will save lives in the future, and is making Minneapolis a better place, and is making the state of Minnesota a better place. So thank you for that work. So I don't know, Chair Lee, if you can talk about that.
Representative Lee.
Thank you, Mr. Chair, and thank you, Representative Jordan, for those comments. So from seeing some of the funding, not directly from this proposal, because, it's not enacted yet, but back in 2019, the state of Minnesota, understanding that there were some issues with this, we were able to secure some funding through the 2019 Environment Finance Bill to give back to the city to really get out there. And so 4 of the programs I would like to highlight that, the city of Minneapolis was able to implement. Number 1 was to identify and educate at-risk residents on asthma's triggers. Number 2, to enroll families with children suffering from poorly controlled asthma in a new asthma trigger mitigation program. They were able to implement community and block-by-block blood lead level screening events in cooperation with local clinics, which Mr. Hanlon touched on. And also, they were able to identify and connect affected individuals with resources to help reduce their environmental exposure to lead. And so I think that, this is just, after consultation with the residents that were impacted, this is the program. And it is my hope that, we don't have any situation like this in the future, but if we do, that the local community health board actually go into the community and actually solicit input on what can we do with some of these funding to address the concerns that we have with our health.
Representative Finke.
Thank you, Chair Hansen, and thank you, Representative Lee, for this bill. I'm very excited about this bill. I'm excited it gives us a chance to do what Representative Gilman asked us to do earlier, which is hold corporations responsible and make them pay for their problems, which is one of my favorite things to do. But I have a factual question, which is how many settlements over $250,000 a year does the MPCA receive? And then do we know how much like cumulative money that is at a year? And if we don't have that in the room, I'm happy to get it, but if we do, that would be great.
Representative Lee?
So in preparation for this, I think Mr. Johnson is here too, and so I will let them talk about that a little bit more specifically.
Welcome.
Thank you, Mr. Chair. Again, Tom Johnson, Government Relations with the MPCA. Since 2017, we've had 113 settlements. So that would be a variety of different types of settlements, mostly stipulation agreements. Over $250,000, that would just be 6 in that time period. So this represents a fairly small number of the settlements that we find ourselves in. The overall average penalty amount, excluding the ones over $250,000, is about $25,000 per settlement. So these are out of the ordinary, but we have had some very public, larger settlements, of course, and in those cases, this would add up to a fairly significant amount for a community.
Representative Fickey? Representative Fisher?
Thank you, Mr. Chair. Thank you, Representative Lee, for bringing this forward. This is a great bill. Mr. Johnson, hold on a second. What was the settlement amount for Water Gremlin?
Mr. Johnson?
Thank you, Mr. Chair. I think most of the Water Gremlin issues were before my time, so I might phone a friend on this one. So I'll be maybe Assistant Commissioner Frank Kolash, which is also.
Mr. Kalash, did you hear the question? Commissioner?
Thank you, Mr. Chair and members of the committee. My name is Frank Kolash. I use he, him pronouns, and I am the Assistant Commissioner for Air and Climate Policy with Minnesota Pollution Control Agency. We're gathering the full bit of information there. I was involved with the Water Gremlin very early on, but then took a different position within the agency while the settlement was being completed. But my understanding was that that the primary basis for the enforcement tool was excessive emissions of trichloroethylene from the facility and improper reporting of their emissions data to the Pollution Control Agency. I think we also ended up identifying some hazardous waste violations and hazardous waste holding violations from the Pollution Control Agencies. That was the area of regulatory concern that we had, and were also issues with that I think the Department of Health and the local public health agencies had around the tracking of lead from workers back to their homes. But that's a different regulatory agency. So from the environmental side, the Pollution Control Agency side, it was excessive emissions of TCE and failure to report the non-working of their equipment, and then inaccurate emission reports, and then hazardous waste violations.
Representative Fisher?
I'm sorry, my question was, what was the settlement amount? How many dollars?
The amount.
Thank you.
Commissioner?
Thank you, Mr. Chair, Representative Fisher. Doing the quick math, it is $4.5 million.
Thank you. And the reason I bring that up is at the time it was the largest settlement that had happened in the state of Minnesota. What was considered to help the community was the planting of trees that could be planted 40 miles away from the city of White Bear Lake where this occurred. No input from the community at all. The community was harmed in the process, and so I'm very thankful for Representative Lee for bringing this forward, because it's important to have their input into this. I mean, to plant trees in other communities after the harm was done in the local. And as was referenced here, this was a company that was an extremely bad actor. 25% of the kids that were tested that worked there had lead poisoning in their system. Every single employee's car had so much contamination that they had to be cleaned multiple times because of the lead in there. We're talking about people or companies who are typically bad actors falling into here, and they've greatly harmed the community. And this is why we need bills like this to help the people who lived around Northern Meadows, to help the people who lived around Water Gremlin, to be able to get something that addresses their needs. Furthermore, we have to start looking more broadly is how do we track the people who live there and follow the long-term effects, because the methods we have now only take a look at people who live within a zip code at certain periods of time, does not account for people who lived there and moved, had problems, but because of where they live at the time, the problems are not counted. And this is a tough issue to figure out. I know that this is something Representative Clark looked at, but this is something we have to come back to probably in the Health Committee to figure out how do we monitor so we can actually track and then address these issues long term. Thank you.
And the motion is to send it to the Health Committee. Representative Heinzman. And then we are going to vote.
Thank you, Chair. I would have a question starting on line 2.35 and then extending into line 3.1. Representative Lee, all in all, I think there's some good stuff here. I do have questions because on line 3.1 specifically referenced is reasonable costs it incurs to administer the paragraph from the funds transferred to the board under this paragraph. In lots of other subject areas, Mr. Chair, we have limits to the dollars that can be used in administrative costs. I can think of many other in the LCCMR and other categories. Is there a reason that we're not putting in some guardrails here, Representative Lee?
Representative Lee.
Thank you, Mr. Chair. So when this proposal was moving forward last year, this was some of the language that was proposed from the community health boards. And so as we move to the Health Committee, we could revisit this so that we ensure that, if members of the legislature, the state, if this was to move forward, if we want some guardrails, we could amend that on in the next committee.
Thank you, Chair. Additionally, Representative Lee, if we could have a better idea what specifically these groups would be spending these dollars on, that would also be helpful.
Representative Lee.
Thank you, Mr. Chair. And, I think that's why we allow for the language for the community health boards to reach out to the communities to really look at some of the projects that could benefit them because of the results of this. And if we want to further define that, I'm open to having the conversation so that we could, scope it down to provide a framework of scope of work and then also allow the flexibility for the residents to provide input to.
I take that as a closing comment, Representative Lee. Representative Lee renews his motion that House File 645 be recommended to be re-referred to the Health, Finance, and Policy Committee. All those in favor signify by saying aye.
Aye.
All those opposed, no. Ayes have it, the motion prevails.